You have probably heard this 100 times. If your back hurts, just walk more. Walking is the best medicine. So you tried. Some days a walk loosened you up. Other days, your back screamed halfway down the block, and you went home thinking, maybe walking is not for me, or maybe my back is worse than I thought. Here is what almost no one tells you. Walking can absolutely reduce back pain. But for some seniors, it does nothing. And for others, it can even make things worse at first. The difference is not luck. It is how far you walk, how you walk, and what you do besides walking. In this video, the 3 biggest questions will be answered clearly. When does walking actually help back pain? When is walking not enough on its own? And what simple things should you add so your walks start protecting your back instead of punishing it? You have probably heard this simple advice. If your back hurts, just walk more. Walking fixes everything. And then you tried it. Some days a walk seemed to help. Other days, it made your back throb. And you were left wondering, is walking good or bad for my back? Or am I the problem? Here is the honest answer most people never get. Walking can be one of the best tools for preventing and managing back pain in older adults, but only if it is used in the right way, at the right time, and with the right expectations. For some backs, walking alone is not enough. For others, the way they walk, how far they walk, and what they do besides walking are what make the difference. In this video, walking will not be treated as magic, and it will not be treated as dangerous. It will be broken down into clear, practical pieces so you can finally answer 3 questions for yourself. When does walking help back pain? When is it not enough on its own? And what should you add if you want your walks to actually protect your back, not just tire it out? My name is Dr. Robert Ellis. For more than 20 years working with older adults, there have been patients on both sides of this question. Some say, walking is the only thing that keeps me sane. Others say, every time I walk, my back pays for it. Most of the time, the difference is not their age or their willpower. It is how walking is being used and what is happening inside their spine and muscles when they do it. So let's start with what the research actually says before talking about how to apply it to a 60-plus body. Over the last decade, walking has moved from nice to have to a serious option in back pain research. Several studies in adults, including older adults, have looked at how walking compares to more structured exercise. A review comparing walking to other exercise in people with chronic low back pain found that regular walking improved pain, disability, quality of life, and fear avoidance to a similar degree as supervised exercise programs. In other words, for many people, walking can be as helpful as a formal exercise routine, at least for general improvements. Large population studies have also shown that people who walk more tend to have less risk of chronic low back pain over time. One big cohort study found that walking more than about 100 minutes per day was linked to a roughly 23% lower risk of developing chronic low back pain compared with walking less than 78 minutes per day. The benefit increased as walking time went up to around that 100-minute mark, and then leveled off. Clinical and physical therapy guidelines for low back pain, including guidelines for older adults, consistently recommend staying active and often suggest walking as a safe, low-cost option most people can do. Some trials show that people in a simple walking program, sometimes combined with education about back pain, can go longer between painful flare-ups than people who do not walk. So, on paper, walking looks very good. It strengthens and coordinates the muscles that support your spine, improves circulation and joint nutrition, supports weight and blood sugar control, and can even improve mood and sleep, all important for chronic pain. But that is the early proof. The reason so many older adults still feel confused or disappointed is that how walking is started and progressed matters as much as whether you walk at all. The systemic enemy in this story is not walking itself. It is the oversimplified advice around it. On one side, you may have heard, if it hurts, rest, don't move too much. That can lead to weeks or months of sitting more, walking less, and avoiding anything that might set your back off. Physical deconditioning follows. Weaker back and hip muscles, stiffer joints, worse balance, all of which can make even short walks feel harder and more painful. On the other side, you might see headlines and videos claiming, "Walking is the #1 cure for back pain. Just walk every day." If you take that literally and jump from almost no walking to long, brisk walks on hard surfaces, your back and legs may simply not be ready. Pain then spikes, and you understandably think, "Walking is bad for my back." Neither extreme respects what an older body with back pain needs. Not no walking, and not too much too soon, but a graded, realistic walking plan, adjusted for your spine, your joints, and your overall fitness. Under these mixed messages, a hidden condition often appears: walking mismatch. This is when your brain has a simple idea. Walking is good, but your body's capacity is far below that idea. Walking mismatch looks like this. You spend most of the day sitting, then go for a 30 or 40-minute walk. Because I heard it's healthy. Halfway through, your lower back and hips start to ache or tighten. That night or the next day, you feel worse, not better. So you stop walking for a week and then repeat the same mistake. The problem is not that walking is harmful. The problem is that the dose and the supporting strength are not matched to your current body. Over 20+ years in geriatrics, it has been seen that the seniors who benefit from walking for back pain are not the ones who walk the farthest or the fastest. They are the ones who start from where they actually are, not where they used to be. They are the ones who combine walking with at least a little simple strengthening and posture work. They are the ones who allow their bodies weeks and months, not days, to adapt. Now, let's turn this into something practical. 3 levels of walking for senior back care, from lowest to highest impact. Level 1 is walking as gentle movement. The lowest impact, better than the couch. At the most basic level, walking is a way to keep things moving without asking for heavy load or complex skills. Even slow, short walks help increase blood flow to muscles and tissues around the spine. They gently move the joints in your hips, pelvis, and spine in a rhythmic way. They prevent your support muscles from completely shutting down from inactivity. For someone who has been very sedentary or who is afraid of movement, a slow 5 to 10-minute walk, even indoors, can be a powerful first step out of the pain and rest cycle. Evidence reviews note that walking, even at low intensities, is an effective and low-cost strategy for managing chronic low back pain and reducing the risk of it becoming more disabling. Public health resources for older adults highlight walking as the most popular and one of the safest forms of exercise, even for those with chronic conditions when introduced gradually. At this level, walking is not a workout. It is a replacement for long, uninterrupted sitting. For example, walking slowly around the house or yard for 5 to 10 minutes, once or twice a day, doing a lap inside the grocery store, leaning on the cart if needed, instead of driving everywhere and staying seated, getting up every 30 to 60 minutes to walk to another room. For many weak or painful backs, just this change can reduce stiffness and make transitions like getting up from chairs less painful. Level 2 is walking as structured exercise, a medium impact level where it starts to train you. Once your body tolerates short, easy walks, you can start to treat walking more like structured exercise. That means slightly longer or more frequent walks, a pace that raises your breathing a little, but still allows you to talk. Attention to posture. Tall, relaxed, with gentle arm swing, rather than shuffling and collapsing. At this stage, walking does more than unstiffen you. It begins to challenge and strengthen the muscles that support your lower back and pelvis. It improves your cardiovascular fitness, so everyday tasks feel less taxing. It reduces fear avoidance. Your brain learns, I can move for 10 to 20 minutes and my back does not break. A randomized trial comparing walking programs with other exercise programs for chronic low back pain found that pain, disability, and fear avoidance improved similarly in both groups, meaning walking can act as a legitimate exercise option, not just a warm-up. Other studies and reviews recommend building to about 15 to 30 minutes of walking most days as a reasonable target for people with low back pain, adjusted for individual tolerance. At this level, your walking might look like 10 to 20 minutes at a comfortable pace, 3 to 5 days per week, on mostly flat, forgiving surfaces. You use supportive shoes and choose routes with benches or places to rest. Over a few weeks, you can go a bit farther or feel less wiped out by the same distance. This is often where people begin to notice that their baseline, how their back feels on an average day, starts to improve. Level 3 is walking as protection and prevention, the highest impact, where it helps shape your future. For older adults who can safely build their walking volume, walking becomes more than symptom relief. It becomes a protective habit. It helps maintain a healthy weight, reducing load on the spine. It supports blood sugar, blood pressure, and cardiovascular health, which all influence pain and healing. It keeps muscles, discs, and joints used to carrying you, so they are less shocked by normal chores or outings. Large cohort studies over many years have found that people who walk more tend to have a lower risk of developing chronic low back pain in the first place. The benefit seems to increase with walking time up to about 100 minutes per day for many people. Beyond that, the extra benefit levels off. One recent population study of over 11,000 participants found that walking more than about 100 minutes per day was associated with a roughly 23% lower risk of developing chronic low back pain compared with walking less than 78 minutes per day. Reports on this work highlighted a dose-response relationship. More daily walking was linked to lower risk, up to that 100-minute range, with intensity also playing a role, but less so than volume. Very few 70 or 80-year-olds will or should suddenly jump to 100 minutes a day. But this research tells you something encouraging. If you gradually increase your total walking time, maybe from 20 minutes to 30, then to 40 over months, you are not just managing today's pain. You may also be reducing your future risk of getting stuck in chronic, disabling back pain. At this level, walking is part of a lifestyle. You might choose to walk to nearby places instead of always driving. You might enjoy social walks with friends or family. You might use walking as a daily reset for mood, sleep, and stress, all of which affect how your back feels. So, can walking reduce back pain? Yes, but not alone and not for everyone in the same way. Walking is often helpful as a gentle, regular movement that reduces stiffness, supports strength, and lowers fear. It is not enough if your back is very weak, your posture is poor, or your pain is strongly driven by deconditioning and nerve sensitivity. It is best when combined with at least a few simple strengthening and stability exercises for the back, hips, and core. For many older adults, the winning formula looks like this: walking most days at a level that is challenging but not brutal. A short routine of back-friendly exercises a few days a week, like bridges, bird dog variations, or sit-to-stands. Some attention to posture and pacing during the day, breaking up long periods of sitting or standing. When you approach walking this way, it becomes a part of your independence plan, not just a pain trick. It supports your ability to shop, visit friends, and get to appointments. It supports your stamina for trips, family events, or travel. It builds your confidence that your back can carry you through the day, not collapse halfway through. You also do not need to see yourself as a walker or fitness person to benefit. You can see yourself as someone who uses walking as a tool, adjusted to your age, your joints, and your pain level. Instead of saying, "Walking hurts my back, so I should avoid it," a more accurate starting point is, "Walking in the wrong way, or too much too soon, has hurt my back. I can learn how to walk in a way my spine can handle, and slowly build from there." If this way of looking at walking and back pain makes sense to you, here is a gentle closing suggestion. Over the next week, pick the level that matches where you are. If you are very sore or fearful, start with level 1, 5 to 10 minutes of slow walking, once or twice a day, even indoors. If you already walk a bit, move toward level 2, 10 to 20 minutes, 3 to 5 days per week, with attention to posture. If you are fairly active, see if you can gradually increase your total walking time over weeks and months, staying within what your body tolerates. Pay attention not just to pain during the walk, but to how your average day feels after a few weeks. Do you stiffen less, stand longer, fear movement less? This is Dr. Robert Ellis. If this video helped clear up some confusion about walking and back pain, and gave you a realistic way to use walking to help your spine instead of hurt it, consider liking the video and subscribing to the channel. It helps more people over 50 find calm, evidence-based answers in a world full of quick fixes and scary headlines. You are not too old to benefit from walking. You are not too broken to take a few more steps. You are simply at a stage where how you walk, how far, how often, and what you combine it with can quietly change how your back feels today and how it treats you in the years ahead.